today we are honored to welcome Tomas Cataldo to the show today. How are you doing today?
Very good, thank you.
Yeah, I'm very excited about this. Um, I've talked about traditional Chinese medicine on the show a few times, and it's very important healing modality that even if someone's not necessarily looking to get um, healed from a chronic disease, they can incorporate practices into their life right now. So I'm extremely excited about this, and I'm very curious myself. How did you get started into this place? Like, did you have a healing journey? Like, what was the spark that got you on the path you are today?
Well, it's partly it's a common story and partly it's unique. Um, I suffered from 7 concussions between the age of 6 and 26.
Wow.
Yeah, that's a lot. Uh, Once I got hit in the head with a line drive baseball when I was about 6. I had amnesia for a
Man.
day. Yeah. And then a couple of childhood playground incidents. I broke my nose once. Fell off a bicycle once. My head hit a curb. 2 in high school football. 1 car accident where I wasn't driving, and 1 skiing accident. And after the last concussion, when I had a skiing accident, I had a headache 24 hours a day, 7 days a week. And I went to my family doctor, who's a very nice guy. And all it was drug of the month club. You know, that's all. Just you go in, you see the doctor. I have a headache because I got a concussion skiing. Okay, here, try this drug. And then you come back a month later and it's like, oh, all right, that didn't work. Gave you diarrhea. Here, try this drug. And that went on for about 6 months. And then I realized, even though I was only, like your age, I was 25. I realized he was out of his depth. And he was a nice guy and he meant well, but he just, didn't have what it took. So then I went to a neurologist and a this doctor and a that doctor and MRIs and scans and blood tests. And, they're all like, oh, we're going to help you. We're going to help you. And then they can't figure out what's wrong with you. And then you never hear from them again, you know? So doctor after doctor, and none of the tests showed anything. Nowadays, I don't know if you ever saw that movie Concussion, but that's a really, really great movie for anybody with a
I
head injury.
haven't, but I'm sure it's a lot of good information in that.
Oh, there is. Now they call it chronic traumatic encephalitis, which football players predominantly suffer from a lot. I don't know how those guys do it, but so what I did was after more than a decade of going from doctor to doctor and then giving up on them, I decided to uh, figure it out on my own. So back then, there was no internet to speak of. This was the late 90s, early 2000s. So there was no real internet. So I went to the library and I read everything I could on diet and nutrition and exercise. And I came up with a plan for myself. And at the time, you know, there wasn't really, keto. Okay. There wasn't really, all we really all we really had as far as diets were concerned was like the Scarsdale diet and the what do you call it, Miami diet or something like that.
South Beach.
Yeah, the South Beach diet. And weightlifters were very well known for eating a lot of meat, a lot of protein. And then beyond that, there wasn't much. So I did a lot of research and I figured out that it was basically inflammation. And inflammation is triggered by 3 things predominantly: alcohol, sugar, and refined starch, like high glycemic starches. So I eliminated those 3 things from my diet, um, with the exception of oatmeal, which was pretty good. And I had the same thing to eat every single day. I had oatmeal for breakfast, grilled chicken Caesar for lunch, and a piece of salmon and some broccoli for dinner. And then I worked out 3 times a week for an hour. Okay, 1 hour, 3 times a week. 20 minutes of calisthenics and 40 minutes of aerobics. And within a couple of months, I had no symptoms. That was it. That's all it took. I mean, you know, if I would have known that, when this happened to me, it would have made my life a lot easier. But so I didn't realize at the time that I had kind of touched a key, okay, with the inflammation aspect of it. And what happened was the diet that I designed for myself um, was so good that you know it was it was perfect. Okay, it was absolutely perfect. Um, and nowadays, when I talk to my patients, I tell everybody, well, I had this diet and it worked for me 25 years ago, but now the food has gotten progressively worse. The food supply has gotten worse and worse.
Hmm.
So, now we have celiac disease, we have, a tremendous amount of allergies and autism and, all kinds of diseases that attack the central nervous system, are predominant, like Alzheimer's and Parkinson's. And what I'm finding out is that the diet that I designed was not just good, it was fantastic. Okay. It was absolutely fantastic because I didn't eat any processed food. I didn't eat any nut or seed oils. It was only olive oil. And I ate green vegetables, green leafy vegetables, which are a great source of, what do you call it? Electrolytes. So, and I had salmon, which is a great source of omega 3s. Uh, and I had, um, a little bit of oatmeal and fresh fruit. Okay, and oatmeal is really good for your digestion. So the diet was so good that I found myself telling a lot of people about it because people would come up to me and say, "My God, you look great. You look fantastic. I haven't seen you in 10 years. You look great." And I'd be like, "Yeah, I feel fantastic. I mean, I feel great." So then I became more and more interested in healthcare, and then after a while, I had a chiropractor friend, really nice woman, and I said, "What careers are there in healthcare?" And she goes, "Oh, there's chiropractor, there's medical doctor, there's this, there's that, there's acupuncture." And I was like, "Oh, acupuncture, that sounds good," because I was always a big fan of Eastern philosophy. So without even knowing anything about it whatsoever, I enrolled in acupuncture college, and that was about 12, 13 years ago. And I did the 4-year program in 3 years, and then I started practicing about how long now? Like nine. I'm in my 10th year now of professional practice, and I wouldn't do anything else. I mean, this kind of practice perfectly aligned with my life, my philosophy, and everything about how I see modern healthcare. And also, it's very convenient because if you have a problem, you can fix it yourself. You know, so it's really been quite a journey. It's one that continues, but um, a lot of people that I went to college with had various problems. Okay, there was a couple of people with Lyme disease, and anxiety and insomnia is really prevalent. And there were some people who were chiropractors, some people who were massage therapists who wanted to do more for their patients. Um, and what we find now, okay, is that a lot of these other professionals are doing acupuncture under the guise of what they call dry needling. Dry needling is just a kind of a half-hearted attempt to do acupuncture without having to go to school for 4 years. You know,
Yeah, yeah.
they take, it's kind of quaint to me, but they take one course, you know, and they're able to do dry needling. Um, which to me it's a compliment because it's their way of saying we want to be acupuncturists. We want to do what you do, you know. So we're gonna make this half-hearted attempt. And I've met, chiropractors and physical therapists who say, "Oh yeah, we do dry needling." And sometimes I'll get a patient come in and say, "Oh, do you do dry needling?" And I'm like, "No, no. Dry needling, dry needling is not what you want. Um, Dry needling is, you want to stay away from that
Yeah,
because you have somebody who basically, took a weekend course and now they're doing acupuncture.
right.
Um, so, um, there are medical doctors who are doing acupuncture. Like, for example, there's this one procedure that we do for incontinence, okay, which I don't know if your listeners might know what it is or not, but it's, when you can't hold your urine, right? So there's this procedure that we do where we put needles in two places on you, one on your lower leg just above your ankle, and another one on your abdomen. And so we put these two needles in, and then we hook up an electrical stimulator, like a little TENS unit, and we electrically stimulate the nerves in these two areas. And acupuncture's been doing this for 1,000 years, but now medical doctors are finding out that, hey, we can do this, and you get great results. So what's happening is that acupuncture is is kind of it's creeping into um, the general awareness of various uh, different medical practices, physical therapists, medical doctors, and chiropractors, and they're finding out that, hey, you know what, this kind of works pretty good. You know,
Definitely.
it's really, I mean, I'm happy. I'm happy for it because anything's better than drugs and surgery. I mean,
Exactly.
if you ask somebody, what would you rather have, acupuncture and herbal medicine or drugs and surgery? I don't think most people would think twice about it. You know, I
Probably
mean,
not. I mean, yeah.
So I mean, I can tell you stories all day about people I've treated because I've probably done somewhere, I don't know, somewhere between 5 and 10,000 treatments, and
It's a lot.
yeah, it's a lot. I think about it myself sometimes. I'm like, wow, that's a lot. And we never closed during the pandemic. You know, I didn't.
Nice.
I live in Texas. We didn't. we didn't. We didn't close down for one day. People would come back after staying away for a year or two. They'd be like, "Oh, when did you reopen?" "Oh, we never closed." "Oh, you never closed?" "Yeah, we never closed." So it's kind of funny. Um, but I'll just tell you like a few stories. Um, I had a woman come in one time. Um, she'd been trying to get pregnant for about 8 or 9 months, and I took one look at her. I go, "Well, you're blood deficient." I could just tell. Like when I walk in the supermarket, I look at people and I know what their problems are.
Right.
You have to turn it off sometimes. But I took one look at her. I go, "Oh, you're blood deficient. You need to build your blood." So I told her you need to eat red meat. You can, wheatgrass is really good. Bone broth is really good. Grass-fed beef is really good. And on top of that, you need to take this herbal medicine, and it'll help build your blood. And the herbal medicine I recommended, every person in China knows what it is. Like in China, it's not a secret. It's it's kind of funny because when a woman in China gets pregnant and has a child, her mother will typically move in and stay for 30 days, and she'll bring herbal medicine. You go to the corner herbal store and you're like, okay, I need suwu tong, right? And they're like, oh, did your daughter give birth? Yeah, okay. I mean, they know what blood builders are. Dongui, angelica root. Okay, so you know, um, there's a whole, it's part of the culture. Okay, it's part of the culture. whereby when something happens, they just know what to do because acupuncture's been there for literally 3,000 years. Okay, there's actually a textbook called the Wang De Ne Jing. Wang De Ne Jing. Wang means yellow emperor. Ne means inner, and Jing means book, as in like a Bible type book. Okay, so Huang de Ne Jing, the Yellow Emperor's Inner Classic. Okay, that's a 3,000-year-old book on acupuncture. And get this, that book is a compendium of other books. Okay, so we know that acupuncture is more than 3,000 years old. And we also know that it has evolved and it's part of the culture. So so this woman that came in to see me, I gave her one bottle of herbal medicine in pill form. I gave her one acupuncture treatment, and she got pregnant the next month. Okay, and she was so thrilled she couldn't believe it. When it came time for her to give birth, I did acupuncture to induce labor rather than going into the hospital and getting the Pitocin. I don't know if you have kids or not, but um, when a woman is ready to give birth, when she's full term, um, if she's if she hasn't delivered yet, they'll give her Pitocin, okay, which is the drug that induces labor. Okay, so so what happens is that the herbal medicine, the acupuncture, and I might as well go over this. There's like about 6 different parts of acupuncture. Um, the word for acupuncture, let's see if I can remember it, uh, Genju, Genju. It actually means acupuncture and moxibustion. Moxibustion means to burn a plant, okay, called the mugwort, the common mugwort. In Latin, it's Artemisia vulgaris, which means the common mugwort. And so acupuncture, it consists of needles, heat therapy, herbal medicine, cupping, electrical stimulation, and Tui Na. Tui Na translates to pulling and rolling. It's kind of like a Chinese mix between chiropractics and massage. So so there's these 6 what we call modalities of acupuncture, and each one of them is fascinating just on its own. But when you go to acupuncture college, the first thing you do, well, the first thing you learn is foundations. You learn the yin and yang of diagnosis. So you learn yin and yang. You learn about points, acupuncture points. You learn about Chinese herbs. Those are the 2 big ones. And then you take classes on cupping, advanced techniques like cupping and Tui Na is a separate class. And there's, like I said, the electrical stimulation. So, so all these things comprise acupuncture, but the sole focus of acupuncture um, is to increase blood flow to the affected area. Okay. So what happens is um, if a person is blood deficient, you need to strengthen their blood. If they're not getting enough blood flow to a certain part of the body, you do needles and affect the blood flow. When it comes to the yin and yang of diagnosis, okay, I'll give you a perfect example. Okay, so let's say somebody comes in and they say, oh, I've got this pain on my side here. Okay, the first thing I'll ask is, does it hurt when you press on it? Okay. Well, if it hurts when you press on it, then that's a yang pain. But if it feels better when you press on it, then that's a yin type pain. Why is that? Because a yang pain, okay, if you apply pressure, pressure is yang. So if you apply yang to yang, you're going to make it worse. Okay.
Okay.
But if it's a yin pain, and you apply pressure, well, yang is the antidote to yin when it comes to diagnosis. Okay? So if somebody has a pain and you apply pressure, well, that's a yin type pain because the pressure, which is yang, balanced out the yin of the pain. Okay, you follow?
Yeah, that's very interesting. I haven't heard of this before.
Yeah. So this is what you get taught first. Okay, is the yin and yang. Okay. So so what happens is you then take that yin and yang diagnosis to the next level. Okay. So what they say is that there's a certain there are things that are called evils, okay, that cause disease. Okay. So there's excess heat, excess cold. Okay. There's dampness, there's dryness, there's wind. Okay. And if somebody has excess heat, well, you want to give them something cold. If somebody has too much cold, you want to give them something warm. If somebody has dampness, you want to give them dryness. And if somebody has dryness, you want to give them dampness. Okay. And the common cold or the flu, they call that wind. Okay. So wind, okay, they called it wind because if a person went outside and they were outside for too long in the cold, they'd get a cold, right? So they called it being out in the wind or wind. Okay. So wind relates to common cold and flu. Okay. So that's like an external pathogen. So what happens is there's two main kinds of wind. And if you think about it, when somebody has a cold, they could either have a fever, okay, or not. Okay. So if somebody has a fever, we call that wind heat. Okay. And if
Okay.
somebody doesn't have a fever, we call that wind cold. Okay. So what happens? Well, when somebody has a fever, well, my son, I have two sons, and one of my sons had a fever when he was, I don't know, 8 or 10 years old, and he was burning up, and so what I did was I reduced his fever, okay, but I didn't give him Tylenol, okay. What I did was, I would never give him Tylenol. Stuff is dangerous. So he was laying in bed. I had him lay face down, and I put some like massage oil on his back, and I took a gua sha tool. Gua sha is like it's like imagine a credit card, right? Okay, but it's made out of jade.
Okay.
Okay, so something in the shape of a credit card, roughly, that's made out of jade. And I took the tool, put some oil on his back, and I scraped his back with the tool. Now, what does that do? Number one, it causes the blood to rise to the surface. Okay, you're stimulating the skin. So when you stimulate the skin, you're massaging the capillaries. Okay, when you massage the capillaries, you're increasing the flow of blood to the skin. When you increase the flow of blood to the skin, what happens? The blood rises to the skin, to the surface, where it cools off. Okay. So I did his whole back for about 10 minutes with the gua sha tool, and I reduced his fever. Just like that.
Wow.
And you know what? You know what he said? It was so funny. I did his back, and he goes to me, "Oh, can you do that again?" It felt so good. It just felt so good. He loved it. So that that is called gua sha, and you can get a gua sha tool made out of jade, made out of metal, made out of plastic. I wouldn't do plastic. Made out of bone. Okay, there's all different kinds of gua sha tools, but they're mainly made out of jade, and a lot of women use them. They do their face, They have rollers and scrapers and all kinds of stuff for doing their face to, preserve your skin.
Very cool.
So, you know, uh, there's all different kinds of ways to do things health-wise that we've kind of, we've lost with Western medicine. And I have nothing against Western medicine. Don't get me wrong. I think Western medicine is incredible. I mean, anesthesia alone is a miracle. Um, and modern surgical techniques and emergency medical technicians and emergency rooms and all that stuff is mind-boggling. Um, but what I've found is that Western medicine is really good when you're born, okay, to save your life in case of a, pregnancy with complications, or if you're dying, you know, Western medicine is great. For everything in between, I find that acupuncture and herbal medicine probably can work better.
Yeah, I find that as well.
Yeah. So um, I had a patient the other day, really nice woman, came in, athletic type. I hadn't seen her in a few months, and she goes, the last time I came in, I had a problem with my, I don't know, my arm or my leg or something. She goes, you changed my world with what you did. And I go, well, that's what I do. That's what this medicine does. I didn't invent it, you know. I just find that it's really, really wonderful. So, one thing that I'll show you, um, I use I use this stuff. I have some herbal medicine here that I use on pretty much everybody with musculoskeletal problems.
Okay.
Okay, so Jengu Shui. Okay, so you can get this on Amazon for $20. Okay, um, so Jeng means setting, Gu means bone, and Shui means water.
Okay.
Setting, bone, water. So what this is if a person has a musculoskeletal problem, their back hurts, their knee hurts, whatever. This comes in a spray bottle. This one's brand new, but I'll show you what it looks like. Okay. So it's water based and it's got a bunch of Chinese herbs in it. Okay. And when we have a musculoskeletal problem with pain, okay, you spray some of this on and you're good to go. I mean, it's unbelievable how well it works. And this isn't even the best one. This is just, I like to recommend this one because you can get it on Amazon. So all it's got in it is what we call blood movers. Okay, blood movers help with pain and cramps and tight muscles because what happens is when a person has a musculoskeletal problem, um, a lot of times what will happen is the muscle will go into guarding mode. Okay, guarding mode. Okay, the muscle tightens up. Okay, because if it gets hit again, it doesn't want to get further damaged, so it tightens up and makes itself hard. Okay, that way if the muscle gets hit again, it won't hurt so much. Okay, so when the muscle guards, you don't get the same blood flow, and as we know it, blood contains oxygen, nutrients, healing proteins, all kinds of, white blood cells. And when that flow is reduced, the healing cannot take place as well. So a lot of people ask me, well, would you recommend cold or hot for an injury? And I say, after the first 24 hours, it's always hot or warm, okay?
Okay.
Because that'll move the blood, okay? It's all about moving the blood. So when it comes to diagnosis, okay, um, there's excess heat, excess cold, excess damp, excess dry, and then wind cold and wind heat. Okay, so for example, um, you know, uh, a person could have damp cold in the lower jiao. What does that mean? Okay. Um, First of all, the your torso is broken up into three sections. Okay, upper, middle, and lower. Okay. The lower is below the belly button. The middle is between the belly button and the diaphragm, and the upper is above the diaphragm. So we call those jiao: upper jiao, middle jiao, lower jiao. So females notoriously can have cold damp in the lower jiao. What does that mean? It means that they have excess cold in the reproductive system, okay? And that cold, okay, just like when you have a glass of a cold drink in the middle of the summer and you're outside and the water beads up on the side of the glass, right? That cold attracts moisture, okay? And the moisture, over time, it condenses. And when it condenses, it forms nodules like fibroids, okay? So a female can have fibroids, PCOS, endometriosis, any one of a number of different ways it'll manifest, okay? And what I tell females in that case is, number one, you have to avoid eating cold food. Number two, you want to introduce warm food whenever you eat. So I always point out that when you go to an American restaurant, you sit down, what's the first thing they give you? Ice water. Really bad. Okay. You go to a Chinese restaurant, what's the first thing they give you? A pot of hot tea.
Really?
Right? Okay. So the reason for that is because your stomach likes warm. Okay. The worst thing you can eat is ice cream. Worst thing. Your stomach likes warm. So when you have a nice hot meal and then you douse it with ice water, you're telling your stomach, now you got to work overtime. Okay. So
Yeah.
um, whenever you eat, you either eat a hot meal or at the very worst, you have room temperature water or room temperature drink with it. You never want to have an ice cold drink with a hot meal. Okay. And if you're a female with PCOS or fibroids, it's double bad. Okay. So there are foods that you want to eat, and you want to eat your meals hot, but then there are foods that have the property of being cold. Okay. What does that mean? Okay. Um, some foods like watermelon. Okay. Watermelon is just cold. Okay. You can have a watermelon in the middle of the summer and you crack it open, it's cold inside. Watermelon is known for having the property of being cold. Okay. Some foods are known to have the property of being warm. Cinnamon. Okay. If you consume cinnamon, you get warmed up. Doesn't matter what the temperature is, you get warmed up. If you eat, spicy foods are warm as well. Um, but cinnamon is the best example of a food that is just warm by property. And the other end of that spectrum is watermelon, which is cold by property. Okay. So for a female with fibroids or PCOS, you want to avoid cold temperature foods, you want to avoid cold property foods, and you want to have warm foods in your diet. Cinnamon is the number one gynecological herbal medicine in Chinese medicine. Okay.
Really?
Cinnamon. Okay. Um, there's two kinds that we use. There's Guizhi. Guizhi is the milder form of cinnamon. That's think of the branch of the cinnamon bush, right? And then there's Lo Gui or Ro Gui, depending on what part of China you're from. Um, Ro Gui is the bark. It's the more intense part of the cinnamon plant. and that's really, really warming. Okay. So when it comes to herbal medicine, um, you have warm and cold. A person can have excess heat or excess cold, and the way you deal with that is you give them the opposite. Okay. So if somebody's got damp cold in the lower jiao, okay, you want to give them warm, and you also want to drain the dampness. So what Western medicine calls a diuretic, we call draining. Okay, a diuretic makes you urinate. So we have diuretics, but we don't call them diuretics. We call them downward draining herbs, like fu ling or Latin poria. Okay, is a downward draining herb. So then, okay, you have hot and cold, you have damp and dry. Okay, and then there's all other categories. Well, there's a lot of other categories of herbal medicine, but let me just touch on one of them. Um, every one of your internal organs, the five major ones, so liver, heart, spleen, lung, kidney, right? Each one of those five organs can be in excess or deficient in one way or another. Okay. The most popular one for females is the liver. For men, it's the kidneys. Okay. Why is that? Because in females, the liver controls the reproductive system. In males, it's the kidneys. Okay. Um, and incidentally, for females, the magic number is 7. For males, the magic number is 8. Why? Because 7 times 2 is 14, and that's the first period, the first menstrual cycle. 8 times 2 is 16, male sexual peak. 7 times 7 is 49, that's menopause for women. 7 times 8 is 56, manopause. Okay, so for females, the liver is the most important internal organ. Um, and typically, when a female has reproductive system problems, it's the result of the liver. And I'm not talking about Western medicine liver, okay? I'm talking about Eastern medicine liver, okay? So what happens is the liver has both a yin and a yang aspect to it, okay? So if the liver is not happy, okay, if the yin of the liver is too low, okay, so if the yin of the liver is too low, the yang of the liver will rise, okay? And what happens? Well, if the yang of the liver rises, that can cause, in addition to menstrual problems, it can cause blurry vision, migraines, all kinds of headaches, hypertension, anger issues, anxiety issues, sleep issues. Okay. So if the yin is too low and the yang rises, what we try to do is nourish the yin of the liver so that it will come more into balance with the yang of the liver. Okay. And the way we do that is with herbal medicine. And there's this one herbal formula that I give to female patients with what we call liver qi stagnation. When the qi of the liver is not flowing easily, we give them this one herbal formula called Xiao Yao San, which means free and easy flowing. Okay, and it's got it's got a number of things in it, including mint, chai hu, a few other things. Because what happens typically is that females will will get a very. Let me see if I can show you. I have something here that I can show you. When females get a liver channel problem, they typically have a very, very classic tongue pattern. Okay, So if you see this pattern right here, chi stagnation, right? Typically, the female will have a tongue with scalloped edges, okay, a red edge, and then typically a thin white coating in the middle, okay. Now, anytime I have a female patient, I tell them right off the bat, I know exactly what your tongue looks like because I've seen it literally thousands of times, and I know exactly what you need, and and you have a liver qi stagnation problem. So when the yin and the yang of the liver are not in balance, not only does it cause yang problems, but it also causes a qi stagnation problem. What does that mean? So what happens is, I mean, if you want to think about it in Western terms, the liver is responsible for over 500 metabolic processes. It controls your blood sugar levels. It processes food. It does so many different things. Um, in Chinese medicine, um, the liver is um, an extraordinarily important organ, like I said, for the female reproductive system. So when it's not functioning properly, it's typically the result of a bad diet. So here we are back to diet. Um, and what's the number one problem with diet today in America? Alcohol and sugar. Okay, that's our that's
Yeah.
our nemesis in America is alcohol and sugar. If I know alcohol is really deeply ingrained in the social fabric, but if I could, with the wave of a magic wand, I would eliminate all alcohol on the planet. Um,
Interesting. Yeah.
Alcohol is just so bad. And what happens? Well, when you drink alcohol, um, it occupies your liver. So your liver says, all right, time out. We got to process this alcohol before we do anything else. So that's why when a person drinks too much, they get hungry because your blood sugar drops because your liver is not processing food, it's processing alcohol. So, um, so typically, if the diet is bad, if a person's eating too much sugar or drinking alcohol, that will have an effect on your liver. So your liver channel will then cause menstrual symptom problems, menstrual cycle problems, and it can also cause, like I said, problems with headaches and vision problems and anxiety and anger and insomnia. So what we try to do is we try to get a person to adjust their diet first because there's a great saying. There's a restaurant in town here where I live in Austin, a vegetarian place. I'm not a vegetarian, but there's this vegetarian restaurant, and they have this sign over the door, and the sign says, "If the diet is right, you don't need the medicine. If the diet is wrong, the medicine won't help." Okay, so
Interesting.
I'm a living example of that, and the what I talk to all my patients about is the four pillars of a good life, and diet and exercise is one of them. And good sleep, good work, good relationships. There you have it in a nutshell. So diet is extraordinarily important. And since the food supply has gotten increasingly worse since I was a kid, I mean, when I was a kid, you know, back in the 60s and the 70s, they lied to us about everything. You ever see those old food pyramids from the 70s? You
Yeah.
ever see those? They have grains.
Yeah.
On the
I mean,
bottom, they say you should have 4 servings of grains every day, you know? And then above that, it's like, after grains, I don't know what was next, but it certainly wasn't vegetables and it certainly wasn't meat. I don't know what was next, but, beans, legumes, you know, and then in some corner, was green leafy vegetables. I don't even think they put it in there. And, good quality meats, good quality proteins and a little bit of dairy, you know, but they out and out lied to us. I even think, I mean, if I could probably look up, a food pyramid from 1970, but it was just out and out lying. You ever hear about those two studies um, back in the 50s, I think it was? One doctor, uh, what was his name? Dr. Keyes, I think.
Ansel
Yeah,
Keys.
Ansel Keys. Yeah, he did the study where he famously cherry picked his data, right, to show a causal link between cholesterol and heart disease. And we know now that he cherry picked the countries,
Right.
only the ones that had the correlation. Well, the flip side of that is that there was another doctor by the name of uh, Yudkin. Yudkin, I think it was, who did a similar study on sugar. Okay, and he showed, regardless of what country or walk of life, there is a direct correlation between sugar consumption and heart disease. Okay, well, both doctors presented to the American Medical Association, but since the American Medical Association was in the pocket of big pharma and big agriculture, guess who won? Okay, the guy with the cholesterol study who cherry picked his data, he won. Okay, so the guy that said, "Wait, no, it's sugar. I can prove it." They were like, "No, no, no, no. Sugar is too big of an industry. Okay, we can't lose money on sugar, so we have to promote the cholesterol one. There is no fat industry. Okay, there was a sugar industry, but there was no fats industry. Okay, so so then after 75 years of following that, where are we? Okay, we've got all those statins, right? So we have statins which lower cholesterol. Okay, meanwhile, we have an increase in Alzheimer's and Parkinson's, both central nervous system diseases, right? Well, guess what? Every cell in your body has a lipid outer membrane. You know what lipids are? They're fats, they're cholesterol.
Right.
Okay? That includes your brain cells. So when you take statins and you lower your cholesterol level, you know what you're doing? You're damaging not just every cell in your body, but you're damaging your brain cells. I wouldn't come within, a country mile of a statin. Okay? As you can imagine, I don't take any drugs at all, just
Right.
the occasional Chinese medicine. But they with these statins, and you can read that book, The Cholesterol Myth, right?
Uh,
Um,
Johnny Bowden, right?
yeah, yeah,
Yeah,
I
it's a
think
great
so.
book.
Yeah, great book, right? So you can read that book, and you can make up your own mind. But I think, I think the pandemic has shown us all that there's two things you need to stay alive. Okay, number one, don't trust the government, and number two, don't trust big pharma.
Yeah,
That,
that's it.
that's what you need to stay alive. That and have a decent diet and get a little sunshine and go for a walk. You know,
Yeah.
that's really all you need. You don't need anything complicated. And I proved that. I proved it myself. Me. I proved it for me by going on a diet and getting 3 hours of exercise a week. Okay, that was all it took. That was all it took. 3 hours of exercise.
Definitely.
Okay, and avoiding alcohol. You know, now,
Awesome.
now I understand that, you know, there are lifestyle choices, there's genetics, there's, you have to go to work, you got to, you have a job, you got to feed your family and pay the mortgage. I understand that. Okay. So sometimes I'll have a patient and, and I know their job is killing them. I know it for a fact that their job is killing them. So I'll say to them, look, you got to quit your job. It's killing you. Okay. So, either A, you can keep doing your job, and by the time you're 50 or 60 years old, you're going to have major problems. Or B, you don't need to buy a new iPhone, and you can downsize your life, okay? And you can live a lot longer and be healthier. Okay, those are your choices. Okay. So I did it. I went through it. I downsized my life, and you'd be amazed at how little you actually need to live and
Yeah.
be happy. Because people always say, "Oh, well, your health, that's the important thing." Yeah, well, guess what? Yeah, it doesn't take much, you know. But with today's food supply, you have to be extraordinarily careful. So, grass-fed beef, wild-caught fish. I really don't eat chicken that much because they put it through. You ever see that video where they show you what they do to the chickens? They
I
they put them
don't. I
through a
haven't.
chlorine bath and
Oh
they
yeah, I know. Like when it comes to cattle, there's laws on how they get killed, but with chickens, it's kind of free game,
yeah,
unfortunately.
it is. So I tend to stay away from chicken. I have chicken maybe once a month. We tend to, and plus I have two sons that are adult age, so we tend to eat beef, 7 days a week, basically.
Yeah.
A little fish thrown in there, but plus I live in Texas. If you live in Texas, you eat barbecue. That's that's the way it is. It's great. So yeah, so when it comes to downsizing your life and all that, sometimes people say to me, "Oh, well, it's so expensive to eat that way," and I'm like, "No, it's not." You know, I get a pound of ground beef that's grass-fed and finished, and it also has beef heart and liver ground into it. Okay, so I
Yeah.
get beef with heart and liver for $9 a pound. Okay,
Yeah.
and I feed myself and two healthy young men, and that's not expensive.
No, I
That's not
mean,
expensive at all. Um, and the other thing you want to stay away from is the American wheat. I mean, wheat in general you want to stay away from, but American wheat is like, ugh, it's so bad for you.
yeah.
It is just so bad for you. Um, my son can't eat American wheat at all. You know, and I started noticing like about 10 years ago, I started noticing that if we got a slice of pizza from the local place, you know what, I kind of feel bloated and horrible. So we stopped going there. And I found that in Europe, they stopped using Roundup about 5 or 10 years ago. But in America, they still use Roundup. The glyphosate or whatever, however you say,
Yeah.
glyphosate. Um, so European wheat does not have as much cancer-causing chemicals on it, but American wheat does.
Yeah.
That's the big difference. And then about 5 years ago, we started using tallow for cooking. I don't know if anybody uses tallow, but tallow was huge back in the early 1900s. Everybody used tallow for cooking. But nowadays, people started switching over to all those horrible nut and seed and vegetable oils. Well, I tell everybody there's only five fats in my life: olive oil, avocado oil, coconut oil, and then tallow and ghee. Okay, that's it. Those five. Okay. So we predominantly use olive oil and tallow. And I make the tallow myself. It's easy. You get some fat trimmings from the butcher, you simmer them on low heat, and you spoon out the fat and you put it through a filter. You're done. Okay. I mean, it's simple. And the great thing about tallow, the great thing about cooking with tallow is that it's flavor neutral and it's nutritious. And it also has a very high smoke point. So it's great. I love using tallow. Now, back to acupuncture. Um, there's been a number of very, very brilliant acupuncturists through the centuries. And we've been lucky enough that in the last 50 years, we had Dr. Richard Tan. Now, Dr. Richard Tan developed a method of acupuncture called the balance method. Okay. And this you're going to love. Okay. Now, his acupuncture, um, he would be able to eliminate pain in your shoulder by putting a needle in your leg. And I do this all the time. Anytime I get a patient in with a shoulder pain, I do these certain acupuncture points on the lower leg, and the pain pretty much goes away. Um, so Dr. Richard Tan developed this balance method, and how does it work and all that? Well, um, we all know about, or anybody in the medical profession will know about this phenomenon known as referred pain. Okay, so if you, God forbid, somebody has a heart problem, they get a pain down their left arm, right? Well, Why would you get a pain down your left arm if you have a heart problem? Okay. Well, the short answer is they're on the same circuit. They're on the same nerve. Okay. So that's called referred pain. When you have pain in your arm because of a problem in your heart. Okay. There's the same thing is true for the liver. For men, if a man, God forbid, has a liver problem, he could have pain in his right shoulder. Okay, it's a little bit different for females, but that's called referred pain. Now, what Dr. Richard Tan figured out was that it works in reverse. Okay, you can have referred pain relief. Okay, what does that mean? It means that if you know, and we do know, all the different nerve pathways through your body, okay, you can know which parts of the body can alter the function of your internal organs and pain. So, for example, um, I had a patient, a friend of my wife's. She had surgery on her right wrist along the thumb side. Okay. So she came in one day and she goes, oh, I can barely move my right thumb. It's killing me. So I said, okay. I put one needle in her left ankle and the pain went away immediately.
Wow.
Why is that? Because they're on the same circuit, okay? Or they're on two circuits that are very closely related to each other when it comes to your spinal cord, okay? So, so when it comes to acupuncture points, people say, well, how does putting a needle in my wrist help my heart? Well, they're on the same circuit. How does putting a needle in my lower leg help my shoulder? Well, they're on either the same circuit or they're on a paired circuit. Okay. A lot of acupuncture channels are paired. Okay. So you can have lung with large intestine, heart with small intestine. Okay. So these acupuncture channels are paired. Okay. So I can treat your spleen, I can treat your spleen, I can treat your bladder, your heart, okay, with points on your leg or your arm because they're on the same neural pathway. Okay.
Okay.
And that's basically how it works. Okay. Because people always say, I always get the same three questions, how does it work? How many treatments do I need? And, should I feel something? And, what's going to happen? Um, does it hurt kind of thing. And I always tell people, you want it to hurt a little tiny bit when I put the needle in. That's what you call arrival of chi. Okay. When I put the needle in, I put it into your wrist or whatever. Okay. You should feel it and you will. Okay. You should feel it. And the fact that you feel the needle go in means that it's having an effect and we're affecting your neural pathway. Okay. So there's been a lot of great work done in acupuncture over the centuries, but in the last century in particular. The problem has always been that a lot of acupuncturists, especially from the Far East, they'll only pass their secrets down to their family members. They won't write a book. Okay. But Dr. Richard Tan wrote a book, did a lot of seminars, worked with a lot of people. Um, and his method has been built upon. He died, I think, about 10 or 20 years ago. But his method has been built upon and built upon and built upon. And now we've mapped out the whole human body, the whole nervous system. We know which acupuncture channels follow which nerves and which points to use for pain in your shoulder or your knee or what have you. And the way it works is quite simple. Um, if you take your shoulder, okay, well, take the arm and project it onto your lower leg. Okay. That puts the shoulder around your knee. Okay. So I know if I do points around the knee, I'm going to help your shoulder. It's that simple. Okay. If a person has a pain on the yin side okay, of the arm. Okay, so take your arm. Okay, which side is yin, which side is yang? Well, for me, it's easy to see. Okay, where there's hair, that's the yang side. Where there's no hair, that's the yin side. Okay, so if a person comes to me and they say, "Oh, well, my elbow hurts and I have pain over here," okay, that's the yang side. I can do a yin needle on the lower leg to take care of the pain in the elbow. Okay? So um, we've we've reduced this acupuncture thing down to a science, okay, in a big way. And they're also one other thing I wanted to point out about the herbal medicine was that uh, Chinese herbal medicine has been using formulas, meaning more than one ingredient, for thousands of years. Okay, so we have four categories of herbs: the chief, the deputy, the assistant, and the envoy. Okay, so the chief and the deputy will take care of the main symptom. The assistant takes care of secondary symptoms, and the envoy directs the formula to the part of the body that needs it. Okay, what is an envoy herb? An envoy herb will cause capillary dilation in the part of the body that it's directing the formula to. So, for example, um, there's this one herbal formula that I use for my patients with, a neck and back and shoulder and, kind of stiffness and soreness. Nothing serious, just like, from being hunched over the computer all day. Um, and it has in it this one ingredient called Chinese kudzu root. We call it gu gen. Gu gen. Gen means root. So gu gen, or Chinese kudzu root, directs the formula to that part of the body, the back and the neck and the shoulders. Okay. So the fact that we have cinnamon and ginger and other stuff in the formula, the kudzu root directs it to that part of the body, and the other herbs in the formula will help to open up the capillaries. Help to relax the muscles, and the envoy herb directs it to that part of the body. And nowadays, modern medicine is catching on to the fact that if you combine, well, they do it with drugs, we do it with herbs, but they're combining different drugs to create different types of reactions in the human body. They're finally starting to catch on. So, um, do you have any questions?
Man, you just like laid it all out. That was absolutely fascinating.
I'm not
Like you
even
got
halfway done, but I'm out of time.
I mean, you got like so much insights, man. It's pretty amazing. Yeah, but we talked about everything from your story, which is incredible. We talked about acupuncture, all like the things in between it, like a lot of things I wasn't even familiar with. Herbal medicine, like a lot of things that people can think about, put in perspective, and perhaps maybe if they're dealing with modality, uh, try Chinese medicine. So I really
Yeah,
enjoyed this.
good, good. I'm glad you did. I can come back if you want to extend it, but
Yeah,
I have
I
another
mean,
commitment shortly, so I got to hit the road.
yeah. So I know that people are going to perhaps want to learn more and get connected with you. So I'm curious, how can I do that?
Anybody can email me. It's just goldentouchacupuncture@gmail.com. You can email me anytime. I try to answer every email I get.
Awesome. Thank you so much for coming on and sharing your insights with us. I know people are going to get a lot of value out of this. And yeah, I just really appreciate it.
My pleasure. You take
All
care.
right. You too.
Okay. Bye bye.